Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, doctor. Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Actually, our brain functions in a peculiar way. Every function that a brain performs, it sends signals through tiny nerves, right? And these signals add up to create that function. Sometimes these signals become excessive and abnormal. You can compare it to some sort of storm on the background of a very calm and cool beach in the brain. And these storms of electrical signals leads to seizures in which patients sometimes shake up, sometimes they tremble, one part of the body or sometimes the entire body, it becomes stiff, it starts jerking off, and on many occasions the patients lose their consciousness for a variable period of time, and even they bite their tongue, there is frothing from the mouth, there is involuntary urination, and all the symptoms together we name it as seizures, or sometimes colloquially we call it fits. So this is what seizures is all about.
What is epilepsy?
See, epilepsy is a disease. Seizures is a symptoms. So when some patient suffers from repeated seizures, we label the entire disease as epilepsy. So basically, epilepsy is a collection of seizures, a disease in which a patient suffers from repeated seizures. This epilepsy can be due to many causes. It should not have some very obvious precipitating features, like suppose some patient may suffer from seizures only when he is febrile, that he is at the peak of a fever. Apart from such conditions, whenever there are seizures and repeated seizures, we term the disease as epilepsy.
What are the different types of seizures and do they affect people differently?
The classification of seizures is a very standard classification that has been issued by the International League Against Epilepsy, and basically based on which all parts of the brain are involved and which all parts of the body are involved in the seizures, we can classify the seizures into either a focal seizures or a generalized seizures. In generalized seizures, the entire body is involved and often the patient loses his or her consciousness. Whereas in focal seizures, one part of the body is involved and the patient may remain conscious or may retain his or her awareness during that episode. Apart from these two types, there can be one seizures which are called absent seizures, in which there is a sudden behavior arrest for a few seconds. Then, based on whether the body becomes stiff or the body becomes entirely loose or the body starts jerking up, there are various classifications of the seizures. But broadly, the seizure can be partial depending on whether a part of the brain is involved or not, or generalized, in which the entire brain is involved and it is reflected in jerky movements of the entire body.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
No, ma'am. In fact, in about one third of all cases of epilepsy, the root cause of that epilepsy is never detected. But in about two-thirds of the causes, we can, with proper investigation and proper history, identify a cause of that epilepsy. Many times it is genetic. Such epilepsies are often known as epilepsy syndromes. Then some trauma to brain, some tumors in the brain, sometimes infections in the brain may cause such sort of epilepsies. Apart from that, many metabolic disorders, that is, such disorders in which there is a lot of chemical imbalance in the brain, they may cause epilepsy. Whatever may be the cause, epilepsy is a disease of brain. That is, the abnormal and the excessive electrical signals, they have to arise in the brain and they get propagated in various parts of the brain. The cause may be genetic, the cause may be autoimmune. That is, sometimes the immunity of the body itself acts against the brain and it causes certain diseases which may lead to epilepsy. So it may be genetic, it may be autoimmune, it may be traumatic, that is injury related, it may be tumor related, and it may be infection related. These are the six major types of causes that may lead to epilepsy.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Okay. The most common signs of an epilepsy is a person who suddenly becomes stiff. One part of the body or the entire body starts jerking off. The patient, in most of the cases, will lose consciousness and may remain drowsy for a certain period of time, even after the seizures have gone. The patient may involuntarily pass urine or stool. He may bite his tongue and he starts frothing from the mouth. And in certain occasions, the patient may aspirate his or her saliva or sputum, and chest problems may arise. Then there is something called aura, in which before the actual seizures arrive, the patient gets a hint, gets an inkling of what is going to happen. He starts developing some sense of abnormal sounds or abnormal fear or abnormal lights blinking in front of his eyes, and then it leads to a full blown seizures. In partial or focal onset seizures, in which the entire body is not involved, the patient in some occasions may even remember the incident of seizures, but on most of the occasions, the patients do not remember the episode of the seizures. So these are the common signs and symptoms of seizures. There is one variety of seizures in which all these things do not happen and the patient may suddenly become atonic. That is, the entire body may become loose and he may just drop off. And there is something called absence seizures, in which the patient just starts staring or all his actions become frozen for a few seconds, and then as the seizures go off, he becomes normal again. This variety is called absence seizures. So these are the common signs and symptoms of seizures.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Historically, epilepsy has been related with spirits and ghosts. So, in prehistoric era or when in pre-modern medicine era, this epilepsy was often related with supernatural forces. So, this idea, this misconception, or this superstition has percolated through ages, even into the modern era, and many people still correlate this epilepsy with these supernatural forces, and even on occasions they correlate it with some contagious disease, and people do relate people of epilepsy or patients of epilepsy with a lot of taboos, a lot of stigmas. They face problems at their workplaces, they face problems with their married lives, they face pressure and stress in their peer groups. I think lack of awareness, lack of education, and lack of true knowledge about what the epilepsy is all about, how does it happen, and how to manage it among the laymen is the root cause of this stigma. And a lot needs to be done to ward off this stigma in the present and near future.
How does this stigma affect people with epilepsy?
Yes, yes. Uh, the most common trigger for an epilepsy in a known cause is skipping of medicines. So one
Yeah.
must be very religiously adhered or bonded to his drug regime. That means that he or she should not skip his medicines, and taking medicines regularly on a fixed time according to a fixed regimen is the most important thing one can do to avoid having repeated seizures. Number one. Number two, many seizures are triggered by exposure to bright light, loud sound, crowdy ambience, lack of sleep, some addictions. So one must be away from addictions. One must have adequate sleep. If some dietary habit is causing these seizures, one must avoid all those foods. One must be one must avoid bright light and loud sound. And the most important thing is that one must not skip his or her medicines at any cost. Again, mental stress and fatigue and of course high temperature. These three things are also very important in this list. So one must be very prompt in managing his fever. One must keep his or her mental stress under control and must live a disciplined life so as to not allow these triggers to go off.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
The most important healthy tips to prevent epilepsy can be applicable to general health awareness as well. That is, having healthy diet, having a disciplined lifestyle, moderate workout. Of course, very heavy workout for epileptic patients are not recommended until unless under guidance of an expert. And the most important thing is having an adequate sleep and a stress-free mental status.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
To prevent seizures, one must be very cautious while driving. In fact, an epileptic patient should not drive. He or she should not swim. He or she should not work near any sharp instruments or fireplaces. So, microwave oven is a better option than fire stoves as far as cooking by an epileptic patient is concerned. An epileptic patient may injure himself with sharp instruments and knives or sharp edges of the household items. So better to keep all the sharp edges of household items, tables, chairs, etc. padded. The flooring must be compliant to minimize the injury once the patient becomes epileptic. And once an epilepsy has occurred, the caregiver, the primary caregiver, the friend, the family person who is in vicinity of that patient, he must uh, lay down the patient. He must turn his or her face to one side so that the patient does not aspirate or swallow his or her own saliva or sputum. And then he must call an ambulance or a healthcare provider so that a medical help reaches as soon as possible. A lot of superstitions go in which dictate that the patient must be bitten with shoes or he must be made to smell something or a cold spoon is inserted into the mouth. A lot of superstitions in various parts of countries go like this, but one must avoid doing any of these things may be harmful to the patient. So just lay down the patient, just turn his or her face, wait for the seizures to end, and in the meantime, call an ambulance so that the patient reaches a healthcare provider on time who can control the seizures. And to prevent, one must avoid swimming, one must avoid working near fireplaces, one must avoid working with sharp instruments, and of course, one must avoid driving. All these works, if at all has to be done, must be done under close supervision of an expert who is already always ready to save your life with such a situation arises.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
My final advice to all the patients is that, and their relatives or the common people, is that epilepsy is a very pretty common disease. A lot of stigma, a lot of taboos have been associated with the disease since centuries, but now we live in the 21st century. we live in a scientific era. We must understand the true nature, the basic tenets about the disease, and we must help these people live a healthy life. An epileptic patient can lead as normal a life as any other person with proper medication and regular advice from his or her doctor. And I wish all the epileptic patients in the world a very free and very healthy life from me and my entire team at Pramila Hospital, where I work as a consultant. Thank you very much.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.